Medications and treatments. What sorts of treatments can be used to combat OCD? Medications can include antidepressant medications, and other medications can be used in relation to symptoms of anxiety. Here though, we'll take a look at therapeutic treatments or aids. So, can therapy for OCD help? Absolutely yes. A professionally trained and registered psychologist/psychotherapist can help a great deal. Psychologists and other workers who deal with anxiety disorders are generally well equipped in conducting competent, professional, valid, effective forms of therapy well suited to helping sufferers of OCD. I have been a patient through several years of therapeutic treatment of specific forms of psychotherapy conducted by a psychologist, and I understand and appreciate how effective therapy can be despite my early doubts about such measures. In dealing with OCD, or in the treatment plan, therapists most likely will not nail you down to a chair and try to psyche you out. They use proven techniques through very reputable forms of therapy. It can be frightening for the new sufferer/patient/client, and this is understandable. However, no therapist should invade your privacy. They will uphold ethical values and respect you as a person in most situations, and not see you as any sort of sick, helpless, or crazy person. A crucial part of the training of any therapist is that of ethics, human rights, and being non-judgmental. A therapist can be a great friend, or at least a real cornerstone, as in being such a valued asset in conquering this tormenting disorder. Depending on the severity of OCD and other individual influences, therapy may last from a reasonably short-term time frame through to years of therapy. Many other factors may influence the length of time that therapy may be needed, yet with perseverance, general support by significant others, and many other useful things or people that we can employ in our recovery, a combination of therapy, medication, dealing with other professional workers and paraprofessional people such as telephone counselors, leaders of support groups, and more can all contribute to overcoming which was once regarded as an untreatable disorder. It is treatable, and I once seriously disbelieved this, but with therapy and other tools, it can be amazing how OCD can really be defeated in a way that it no longer cripples our lives. Checklist. Therapy is proven to help people with OCD. Therapy for OCD is not some sort of psyche show. Therapy involves proven techniques. Therapy can vary a great deal in length. OCD is treatable. You can improve your life. A combination of medication, therapy, and other factors are often needed to combat OCD. There is great hope, highly effective therapy, and understanding and accepting people who can help us, one of these being a psychologist or other psychotherapist who really is able to help with specialized forms of therapy to fight against OCD. So, if therapy can help, what is it all about, and what type of therapy is there? For now, we'll discuss a little about the best, most suitable, and reputable, and the most commonly used type of therapy employed in the treatment of OCD. So firstly, what is used for psychological intervention for the treatment of OCD from a therapeutic point of view? The most commonly used and most reputable or recommended type of therapy for OCD comes from a broad type of therapy called cognitive behavior therapy. CBT, as it is known, cognitive behavior therapy, is a broad term that relates to more specific types of therapies. It is like an umbrella term. Particular types of therapies, under CBT, include therapies such as rational emotive behavior therapy, REBT, and cognitive therapy, CT. And, for the treatment of OCD, many therapists will use cognitive therapy and another type of therapy called exposure and response prevention, or ERP, which falls under behavior therapy. Note, both CT and ERP both fall under the broad umbrella term of cognitive behavior therapy, or CBT, as these are two specific forms of therapy which are used to help those who are battling with OCD. CT, cognitive therapy, is derived from CBT, cognitive behavior therapy, and ERP, exposure and response prevention, is a type of behavior therapy. Therefore, to put it simpler, two forms used by therapists to help people with OCD are cognitive therapy, CT, and behavior therapy, BT, which fall under CBT. Both CT and BT have many very specific techniques, much like how a particular politician has his ideas and how his rivals in a different party have different ideas on how to approach things in society. As stated, CT and BT, along with many others, fall under the term of CBT. Cognitive therapy employs particular techniques in helping those with OCD, and so does behavior therapy. A specific technique for helping people with their compulsive acts is known as exposure and response prevention, or otherwise known as ERP. So basically, psychologists often use cognitive therapy, CT, and exposure and response prevention, ERP, which falls under BT and in turn falls under CBT, to help many sufferers of OCD, although both are not necessarily used, and from my experience, are they any good? Yes, they are. So, just to recap, cognitive behavior therapy, CBT, is generally the choice treatment of therapy used in helping those with OCD. CBT is a rather broad type of psychotherapy which actually encompasses a variety of, yet similar, subdomains, or types, of therapy. There are many more specific types of therapies falling under CBT, which is sort of like a parent name for many different types of specific forms which basically fall under the term of CBT. There is indeed a type of psychotherapy known as CBT, but it also includes other more specific forms such as cognitive therapy, CT, rational emotive behavior therapy, REBT, and many others. As a patient myself, my psychologist used both CT and BT/ERP, and both were rather effective, in fact very effective. I cannot speak highly enough of cognitive therapy and exposure and response prevention when it comes to the treatment of OCD. Both of these were used for myself in a hand-in-hand fashion, although when I began treatment I had no idea what they were about or what to expect, or in fact anything, let alone having ever heard of them. So, cognitive therapy, CT, and exposure and response prevention, ERP, are used under the umbrella of cognitive behavior therapy, CBT, and are rightfully recommended and commonly used for helping people to overcome OCD. What is it about? So, what is CT and ERP about in relation to the treatment of OCD? Firstly, let's just be reminded that medication is often necessary too, or for severe OCD it is very necessary. I still have to take 80 milligrams every day of fluoxetine, which is a particular type of antidepressant, and I'll have to for the rest of my life. However, it certainly is worth it, and I would not want to stop taking them as my symptoms are now under control and several doctors have told me never to stop taking them. But, focusing back on the therapeutic element of the treatment of OCD, what are these psychological treatments about in relation to OCD? We'll start with exposure and response prevention, ERP. ERP, exposure and response prevention, is used in order to help sufferers of OCD to resist their compulsions. Remember that compulsions in the long run only reinforce obsessions and are rather destructive. Compulsions must be broken, stopped, and dealt with to conquer OCD when one suffers both obsessions and compulsions, as most people with OCD do. So, how could ERP help with compulsions? As the name implies, the patient is exposed to certain objects and situations. I practiced the techniques of ERP many times in my recovery of OCD, so I would like to use some of my own problems I had as examples here. I'll talk about the patient as being myself here. One example of an obsessive-compulsive problem I had among virtually hundreds was hanging out the washing. I used to have to hang things in particular ways and by touching the clothes in certain ways or manners. Behavioral compulsions here included the touching of clothes, others were involved, but we'll keep things relatively short here. My therapist exposed me to this problem that I had. By exposing here I mean that she literally went out to the clothesline with me and made me hang out clothes, exposed me to my problem. This also included experimenting a bit, such as hanging shirts upside down, the wrong way around, or whatever. As the name exposure and response prevention implies, the next stage comes the prevention of the response, and for me here it meant that I had to prevent myself from touching all the clothes unnecessarily. One part of what I felt like I had to do, and I did previously, was put my fingers in all of the sleeves of t-shirts and so forth to make sure that they were perfectly hung. It is clearly way above or different to perfectionist traits. This topic can be expanded on at a later stage. It was clearly excessive and it was absolutely ridiculous in my mind, but I just couldn't help doing it, before I got treatment. So, I was exposed to an obsessive act that I was having problems with and then prevented from responding to my obsessive desire/drive through compulsive acts. I was exposed and prevented. Treatment went far beyond this, and it came in the form of cognitive therapy or CT, which we'll look at in more detail at another time. In a clinical sense, this process is called habituation, in where the exposure of something, here, the clothes hanging, is gradually adapted to in a way that a person with OCD gets used to this exposure and prevention, and eventually the anxiety reduces while doing such activities. In the treatment or practice of ERP, the client, as I did, learns to resist the compulsions, and for me here it was resisting a powerful, invasive, and unremitting urge to touch everything I hung up in a particular way, for example, the sleeves in t-shirts. I also had problems with hanging underwear, handkerchiefs, trousers, just everything. And it wouldn't just be the clothes, it was the pegs, the washing basket, peg basket, and of course it started before all of this with such things as the washing machine, box of soap powder, the clothes basket and switches, touching, counting compulsions and so forth. I have only used the hanging of t-shirts/clothes as an example in the above illustration. How does ERP work though, and can it really help you? Can ERP really help you or anybody else you may know who has OCD? Most definitely yes. This type of therapy is not a haphazard, slap together, hit or miss, potluck type of activity. It is structured and has a high success rate even among those who have severe OCD. I once fully believed that no therapy could help me, as my obsessions were so strong and invasive. I seemed to have no control whatsoever over my obsessions and compulsive acts, both mentally and behavioral. I started my therapy with very strong doubts, or in fact disbeliefs in it. Some people may justifiably argue, dispute or question that if one is convinced that a person will see positive effects from any treatment simply because they are expecting positive results, that it will happen as in a type of placebo effect. Placebo involves a substance or condition that is unable to act or have an effect that can be given instead of an active substance or agent that does have an effect, for example, a drug, in order to see if it instigates or triggers the effects that one believes it would have if it were an active or real substance or agent. It is like giving a little chocolate, say, a Smartie or Mandamp, to a person with, let's say, depression, and telling them it is a special depression tablet and that person believes it, so chances of recovery, improvement, or reduction in symptoms in depression are then believed to be the result of this magical tablet. So, the point here is that I did not approach my treatment with ERP with any sort of placebo type of thinking. Rather, I not only doubted, but actually seriously disputed such methods that it could help me with such a relentless case of OCD. You might wonder what it's all about or question the effectiveness or relativity of it. It is normal, or at least common, to think or believe or question such things. As a former sufferer of a clinically and thoroughly diagnosed case of severe OCD, I truly and fully recommend this type of therapy to anybody with OCD, who is deemed in need of therapy from a doctor. A psychologist will not hammer you inappropriately and try to psyche you out in any way, but yes, it is hard work, no doubt. However, living with relentless OCD is extremely hard work, so is there anything to lose by giving treatments such as ERP a go? Well, you might lose your intensity of your obsessions, for example, but this is what we want. We have nothing to lose as in our self-respect, even if one were to feel less dignified by others, or nothing to lose in the actual healing of OCD in itself. ERP is an appropriate and decent method for anybody with at least moderate OCD through to the more severe forms of it. Remember also though that if a person doesn't really want to get better or lacks motivation, chances are that this person will be stuck in the rut of mental health problems. Motivation is essential and we need to put in the hard work ourselves too, but it really is worth it. It took me 4 years of special OCD treatment and it was hard, but it was also worth every bit of it. Checklist, * cognitive therapy, CT, and ERP are proven methods for helping to manage OCD. * ERP helps the person to resist their compulsions. * Compulsions reinforce obsessions. * The person is exposed to their compulsions and prevented from performing them. * The person learns/practices to resist compulsions. * ERP has a high success rate. * It is normal to doubt such methods and techniques. * ERP can be very hard work, but with proven benefits. So how does it work? Your therapist or psychologist will ask you to identify or make a list of situations or things that you have obsessional fears about. For example, here were a few of mine that I worked with my psychologist. * Making a cup of tea/coffee. * Hanging the washing out. * Going to the toilet. * Having a shower/bath. * Washing up and wiping dishes. * Wiping the kitchen benches, and other items/things. There were many others, but we'll just keep the list relatively short here. What my psychologist did with me here and would do with you or somebody else, was to order these things in an order from the least stressful or least difficult, from my point of view, to the most stressful/difficult or anxiety-provoking. So, the list might then look like this, starting at the top with the least difficult. * Hanging the washing out. * Wiping the kitchen benches, etc. * Washing and wiping up. * Having a shower/bath. * Making a cup of tea/coffee. * Going to the toilet. Your therapist may help you here with rating each of these things out of a scale of 0 to 10, 0 being no problems and 10 being the maximum of problems/difficulties/anxiety. So, hanging the washing out might score a 4 and going to the toilet might score a 9. What happens then is that you, with the therapist, will start working on the least difficult one first, which here is hanging the washing out. You'll probably have a list of about 8 or 10 or so, and as you go this list could be revised and you could work on/approach other obsessional difficulties later on if necessary. For me, as I was able to handle the least difficult ones by myself in time, then new ones were added to the list, or a new list was made up, so I always had a list of about 8 or 10 obsessive problems that I was working on. So you have a list to work with, so what then? You will start working on about 3 or 4 of the least difficult tasks, as per your rating. For a particular person, it could be having a shave or feeding the dog, anything really. Your therapist will then instruct you to do this activity, but first you may be given a sheet of paper, which will be a crucial part of your homework. We will look at this later, to record things such as your expected anxiety and actual anxiety levels on a rating or scale from 0 to 100. My therapist gave me a separate sheet of paper for each different type of task that we were working on. So, a task for a particular person might be feeding the dog. Your therapist will instruct you to do this and encourage you not to perform any compulsions, not saying don't do it, but using other strategies which we will look at later. You will basically be instructed to do this task, for example, feeding the dog, in a normal manner, and not engaging in behavioral or mental compulsions. Now, rather than the therapist saying something like, don't go back and check that everything is alright, the focus is strictly on ignoring the compulsions or bearing the pain of not engaging in them and resisting the urge to do these compulsions, and it can also include rationally debating the irrationality or dysfunctional beliefs associated with compulsions. This is related more to cognitive therapy, CT, though, and CT can be incorporated into your treatment plan, but for now we will stick to talking about ERP. To recap, you will start by doing an easy task first, or one that is not as highly rated on your list. From my own experience, I was instructed to go straight into another task. For example, I started with hanging the clothes out, and then as soon as I finished doing that job, with my therapist with me/accompanying me, I had to do another job straight away, which was something like cleaning my teeth. One of the ideas and things that can eventually work is that you learn not to engage in compulsions, and by being sidetracked by doing something else, you can eventually train yourself not to engage in these mental or behavioral compulsions. This is much easier said than done though, and for me it took years. I was forced to do something else, with the aid of my therapist, but as soon as she was gone and I was left to my own devices, doing it by myself, I yielded to compulsions almost every time for years. I seriously doubted that such techniques would or could work, and admittedly with me my therapist had to employ other techniques too on occasions, for the seriously difficult tasks. However, the point here is that by sidetracking yourself by doing something else, your mind tends to be elsewhere and not purely on the first thing that you did. For me, it was hanging the washing out and then brushing my teeth. So, when I was brushing my teeth, my mind still urgently wanted to think about the clothesline and washing and to respond to all of my obsessions, but now I was doing something else, another thing that I had obsessions about, so my mind was so confused and even tormented as to what to think about. This is one area of ERP that can be very hard work. After this, I had to do something else, such as making a cup of tea, and one for my therapist. Oh, the torment, but it all had a purpose. Admittedly, it was usually hard work, and I was even brought to tears once or twice due to the sheer frustration in my mind and that my mind wanted me to engage in compulsive behaviors or mental actions, but I couldn't. It can be mentally torturous, but no more than the tortures of being captive in the deadly chain of obsessions and compulsions. This is only a brief explanation, and more can be explained at a later stage.